So welcome everybody to Better Health's second Fireside Chat. This is a new series that we began recently where we invite an expert to talk about their experiences, and then we get to ask them questions and learn from them, which is really exciting. Today we have with us Dr. Rosemary Koo. Rosemary actually has an incredibly fascinating background. She is a physician and an executive, which means she's been on kind of multiple sides of this equation, and she's worked with patients and is really passionate about helping people achieve not only physical health, but also mental health. And I think we all have some experience with this where, if we're diagnosed with a chronic condition or we've ever been ill, not only does it take a physical toll on you and you have to adjust to a lot of physical changes, but there's also a lot of mental and emotional changes. You have a lot of questions, you may not have a support system, you have to find an all new community. And this is something that Rosemary has a lot of experience with, and something that we at Better Health are trying to do as well, where we want to get beyond just helping people find their supplies, which we can absolutely do through product consultations and samples, but we really want to expand the offerings for our members, where we provide education, we do these fireside chats, we have a weekly ostomy webinar. We do coaching with some peer coaches, of which Siobhan here is one of our peer coaches and an ostomate. So today isn't going to be limited to just an ostomy focused conversation. It's going to be a wider conversation about just, the importance of finding your support system, getting the help and the information that you need, and how to help, or I guess like advice for patients on how to navigate the sometimes very complex system of healthcare and find their communities. So with that, I will pass it over to Siobhan and Rosemary to introduce themselves and get started.
Hi, everyone. My name is Siobhan. I have been an ostomate for 6 years now. I have an ileostomy. I got my ileostomy when I was 36 years old. And so I would say prior to that, I had ulcerative colitis. And I would say that the ileostomy changed my life and made it incredibly much better than what I've been experiencing with the irritable bowel disease for about 12 years prior to having my ostomy. So, I'm here and I'm very excited to talk with Rosemary today because she's a doctor, but she's not one of my doctors. And I don't get to have that experience too often as a peer-to-peer relationship. So I'm gonna pick her brain about a bunch of different things. So I'm so glad to be here. And Dr. Koo, please tell us a little bit more about you.
Sure. Thanks so much, Ariha, for the intro, and also to Siobhan for setting up our conversation. And you can call me Rosemary on this talk. We'll keep it informal, but it's a real pleasure to be here today. I think the healthcare system really underestimates the power of peer support networks. So we're going to dig into a little bit about that. But first, just quickly into my background. So as Ariha mentioned, I've been wearing a lot of hats in the healthcare industry. I've spent years on the health technology development side with developing systems for chronic disease management. And then more recently, I also currently work with a payer to expand our access to care to the agricultural industry. And I'm also very excited to work with Better Health on developing a peer coaching program that really brings a really unique type of service to ostomates that I think will also be able to serve as a model for how you can effectively manage chronic care, chronic solutions for a variety of conditions. So with that, we'll let you kind of run the show here, Siobhan.
All right. Well, the first thing that we got to do is this is a fireside chat. So we have to run the fire.
So cozy.
It's so cozy. Yeah, we'll ignore the fact that at least for me, I'm in San Jose, it's 92 degrees outside. So it's great that this is a virtual fire. So Rosemary, I'm so excited. Part of the reason that I want to talk to you today is, I've been curious, at least in my own journey, I didn't really realize that I could get involved in a peer group. So, what is a peer support group, and how is it different from friends and family?
Sure. So peer support is a really unique type of support. It's actually bi-directional, and it's a system of giving and receiving support amongst people who have a shared experience. And that shared experience could be anything from new mothers to people with a new cancer diagnosis, or in our case that we think about a lot at Better Health are people with ostomies. And that shared experience is really important. That differentiates peer support from the regular social support that you get from friends and family. Certainly, friends and family can decrease loneliness and you can vent to them, but without a shared experience, they might not be able to empathize or fully understand what you're going through. And so when you are talking to a peer that actually has that shared experience, you get a different level of empathy and understanding, as well as practical tips that you might not get from just friends and family.
All right, that actually clears it up for me. It's true that I do vent to my family and friends, but it's my ostomy, they can't empathize with what it's like to have a blowout, at least from a personal level. And so many of the people that I speak to in my coaching position talk about how they seem surprised and how unexpected it is for them to talk to somebody else with an ostomy. So many of our folks call from places in isolated mountain towns where there may be the only ostomate in town. So I can see how that peer support is so essential and key. And I'm wondering how did you get into this peer support? How did it become important to you?
Yeah, I think, throughout my medical experience through clinical care and also on the development side, I was really humbled by how limited us as doctors are with treating patients. So I'm going to be a little bit self-deprecating here is, if my patient with an ostomy asks me, what clothes should I wear? Or how can I exercise? Or what foods to avoid or foods to eat? As a doctor, I don't know how to answer those questions, unfortunately. And unless someone has gone through an ostomy and kind of the journey afterwards, it's really hard to answer those types of questions. So I think early on in my training, I had an intuition that there were all these questions that I couldn't ask that peers could, there were questions that I couldn't answer that peers could actually answer. And then it wasn't until fairly recently, about a year and a half to 2 years ago, one of my friends asked me to work on a research project to dig really deep into the effectiveness of peer groups. And I was really astonished by what I found. It really validated kind of the intuition that I was having throughout my clinical experience. But basically what I found was that peer support can improve a variety of conditions, both on the mental health side, including things like anxiety and depression. And there's even evidence that peer support can improve chronic condition management. So even with something like diabetes, there is evidence that peer support could almost be as effective as taking an additional drug. So how exciting is that? It's like, a drug could have side effects, but a peer support is really only a win-win. You get the emotional support, you get to vent, you get practical tips from your peers. There's really no downside to peer support, whereas using only medications without that kind of social connectivity could actually have side effects. So it's really exciting to see that evidence out there. And I think we have a long way to go, though, in healthcare to get that model out there. And so I'm excited at Better Health that we're kind of like spearheading that approach.
Great. So that is an interesting story. And I'm so glad that you as a doctor were thinking about that from the patient perspective of, you're human too. So that sometimes you don't get what you need out of a relationship just because of professional obligation or, professional boundaries. So, it's fascinating that you went and you worked on this research project and you wrote a paper from that, correct?
That's correct. It's on the internet, so you can all find it.
Okay, so I'm curious, what is something that the current healthcare system is that most patients don't know that maybe they should know or understand in terms of navigating it for peer support?
Yeah, I think it's a really great question. I think in general, not even related to peer support, is I wish people knew how much they had to advocate for themselves, because a doctor's daily life at work is, you're taking care of, maybe at least 20 people a day in office visits. And on top of that, you might have hundreds or thousands of other patients that could be emailing in. And in order for you yourself to get the best care possible, you have to be your own advocate, which means, asking follow-up questions. Don't shy away from asking things that you want clarified, asking for additional resources, such as asking if the provider or the nurse knows about peer support groups, could be really important. And if something doesn't feel right or something doesn't sit right, in general, it's really important to just be vocal about that and not just assume the doctor knows best or the healthcare system knows best. And so that would be kind of my takeaway message, as the number one recommendation for everyone out there was from a patient standpoint.
All right. So it's true. We all have to be advocates for ourselves. This is something that I tell my coachees and talk about in my webinars, is that your body best. You're the one who can identify if something's wrong and speak up about it. And I know that I think there's some body shame associated with having an ostomy, that sometimes people feel like they've done something to deserve it, or they fail to do something to prevent it. But, the case is really that, it's not some sort of it's not a moral failing. It's not a character failing. People just need ostomies. And so the more that we normalize that, the more, and with peer support and other resources, the better things will go for everyone. And so you talked about this research that you did with the peer support and how it benefits us in a social and psychological way. Is there a distinction there in the way that it benefits us versus, say, more professional support, say like therapy or, things of that nature?
Yeah, absolutely. I think the key differentiator is that peer support, especially with the kind of shared knowledge and practical tips, is really important for increasing confidence and self-efficacy. The more we can feel like we are able to take care of our health, and we know our bodies, and we know where to go if we have questions, that self-efficacy and confidence is really unique to peer support. That is separate from therapy for mental health, because therapy for mental health deals specifically with the emotional responses, like the anxiety and the depression. But being able to get the knowledge and kind of the confidence and self-efficacy, that's really more practical. And downstream, it certainly can impact anxiety. And we see this a lot with our members, is that once they've gone through coaching, the majority of them do report increasing anxiety and depression. But it's the practicality and the tactical skills of going through that coaching and receiving that advice that really differentiates it from therapy and just social support.
I hope you meant decreasing anxiety and depression.
Yes, decrease. Oh, I'm so sorry. Yes, at the end of the day for us, yes, the majority of our members report decreased anxiety and decrease in depression as a result of the coaching they received.
Great. Yeah.
Thank you, Siobhan.
No, it gave me a pause for a moment, and I was like, I hope I'm helping. So yeah.
Yes, you absolutely are.
So, with ostomies, they're a unique peer group. Have you found any ways that the ostomy support groups have helped ostomies? How am I trying to say this? What are unique ways that peer support groups help support ostomates?
Yeah, sometimes I think feeling heard is really important, especially feeling heard by someone who knows what you're experiencing is so key. And we actually get this feedback a lot, is that, just being able to speak to someone who's gone through it, to have someone empathize on a very deep fundamental level, is wonderful. And it's something that we can't replicate in healthcare very easily today. Like, they're not widespread peer group programs that pair you with a fellow ostomy. I wish there was. If there was, fine, we could work ourselves out of that. Like we've solved the problem, but there is a very big problem out there. And in order for people to feel heard, they also need to be connected to people who understand how they're feeling.
Yeah, I agree that feeling heard piece is so essential. That so many people come to us with questions about things that have come up, and not just how daily care stuff, but also very, very personal questions around sex and intimacy, dating, self-image, all of those things that you might get a pat on the shoulder with, if you're seeing a professional and they say, no, you're fine, you're going to be okay. But that we as coaches sit down and listen very clearly and closely. In fact, I would say most of my coaching is actually just listening and, telling somebody, you're absolutely right to feel that way. I would feel that way too. So it's validating for them. And I find that, especially with ostomies, and perhaps with other peer groups that have to learn to manage a condition afterwards, that involves medical supplies, there's very little education. And there is education. I don't want to say that there isn't, but it's often that if it's your responsibility to take care of your ostomy, of your stoma, to remove your ostomy barrier and clean and place a new one, that you may get that information to some small extent while you're either after surgery or after if you do a step down facility like skilled nursing. But at home, often it's only you who can do that. And so you as a patient are trying to learn that, but at the same time, you're trying to recover from surgery. You might have been on the strong drugs after your surgery. So anything that they tell you has gone in one ear and out the other. So yeah, it's very true that the patients come in and they feel heard, and they also feel safe to bring these things up. So, I did ask you, you said there was really no drawbacks to peer support groups. What makes this a successful peer support program in your eyes?
Yeah, I think making sure, there is some framework around the coaching is very helpful. So oftentimes where we can't find answers easily, we go online, right? We're in the days where we Google about our health. And if you just Google things about your ostomy, likely you won't find the right answers online. Or if you find answers, they might not be tailored to your specific case. So if you follow that advice, you could even be putting yourself in danger. So I think it's really important, in order for an ostomy coaching program to work, is that it's developed by a reputable company, and that there is strong medical professionals behind it too, who help develop the program and to help kind of troubleshoot the program as well. Through our coaching program, we hear a lot about people's issues, and some of them are actually beyond what we as coaches can address, especially if there is severe mental health issues, or if there are medical issues that we can't address. However, because of our medical professional background, we know where our scope of work starts, and we know where it stops. And we also know how to, talk to you about, seeking out those additional resources from your providers when you need it. So I think having that level of credibility in a program is really important. It is very tough to get good advice on the internet these days. So going through a company like BetterHealth that has that kind of expertise is really important.
Yeah, And I agree that it's quite often the case that we have to tell people as a coach, you can try this, but you should use your own best judgment. And if you have questions, I have to refer you to a medical provider, because I, as a coach, don't have that. I am not qualified to make recommendations there. So, and I'm curious, so you've done your research in peer coaching. So, that's a one-on-one type of thing. Have you done any research into like the wider support groups? How are things different in a group versus a one-on-one session?
Yeah, I think the dynamic and experience can be quite different, but perhaps one of the largest kind of more group type settings where peer coaching has been very successful has been in Alcoholics Anonymous, and that's not purely group. There is definitely a one-on-one component in there, but it's a huge community. And that's been hugely successful. In settings where there is kind of more group conversation, it's actually really interesting to see that people get the emotional benefits of peer groups, not just from venting. And surely venting is very therapeutic in a way, but when you get a group of people together, you're also able to listen to others who have their own struggles. And even just that active listening without interacting in the conversation is actually just as helpful. So that's like really surprising to me when I start digging into the literature, is that, receiving the advice and, having a forum to talk is one thing. And that's obviously very helpful. But even just having a forum where you can listen to others and watching how others deal with their issues and how they kind of navigate that and are successful through that is equally helpful. And that's actually pretty unique to a group setting, is that you can listen to others' stories and their struggles as well.
Wow, I find that surprising too, that just even the passive listening can be really helpful. And I appreciate that. Sometimes it is nice to just sit back and listen and go, and nod along and say, oh yeah, I totally had that happen too, and to yourself. So I'm wondering, do you have any favorite stories about how a peer coaching or one-on-one coaching has, helped somebody? What were, any favorite outcomes or, unique, unexpected surprises?
Yeah, I guess going back to the power of listening again. So in the beginning of the COVID pandemic, the healthcare company I work with actually asked me to run, and this wasn't actually the language around it. We didn't call them peer support groups, but that actually was what it ended up being, was peer support groups regarding the COVID pandemic for our own employees. Mm-hmm. And I ran these groups within different departments of our organization. And there were probably maybe like 10 to 20 people on these calls. And they were set up as a space where people could vent and share tips about stress management and how they're feeling around the pandemic. This was really early on. This was like March and April of 2020. And consistently, I got feedback after those calls from people who didn't say a word. And I was surprised because, like on those calls, there might have been 5 people or so that were really actively talking and sharing tips. And then usually at least half the group was just listening. And I thought, well, maybe that was a dud. Maybe it was not as successful if people didn't want to share as much. But then almost after every one of those peer group meetings, people texted me or called me afterwards and said, hey, I'm sorry I was really quiet, but I actually found the conversation really helpful and cathartic in a way. And so I think that proves out the research, because research is one thing, right? They study people in a very kind of constrained environments. And so, seeing this real world example of how important listening is and how impactful that can be was really cool for me to see.
Oh, wow. Yeah, that was a difficult time, and I'm so glad that you had the opportunity to work with people who put those processes in place. Because we've been talking about, it's so helpful that everyone that people have that opportunity to feel connected. It definitely in my own experience, managing depression that was associated with my chronic condition, I had to learn that, despite the fact that I kind of wanted to isolate, the way to manage that depression was to form community connections and reach out. And actually helping other people has had this surprising side effect of helping me. I didn't start out I didn't start out anticipating that, but it's something that, I have a profound sense of appreciation for, that these folks are, being very vulnerable to me and building, putting their trust in me, and I'm able to return that. So you're right. It does have an amazing impact on people, depending on, whether they do peer groups or peer support groups or one-on-one coaching. And I wanted to ask, has there ever been an instance where something that happened in a peer support group, or, in the coaching sessions that you come back and review, is that something that surprised you?
Yeah, I think this isn't one instance. This is almost every peer coaching session I review, is how open people are with each other, just because they know there's a shared experience. I mean, people share almost sometimes their whole lives, and certainly some of the most difficult part of their lives with us. And just knowing that you have kind of a safe space to say that opens the floodgates. And it's really incredible that people feel like they can share with us. And when they can't share the same things with anyone else in their lives. So I think it's really special to be part of that. And going back to what you said, Siobhan, about feeling better when you help others, that's another really unique aspect of peer support, is that even though there might be kind of coachy and coach relationships, like there might be slight levels of hierarchy, there's a lot of social theory around, helping those who are kind of in the beginning of the journey that you've already walked in some way, is incredibly therapeutic. And then it also kind of magnifies the impact that you've already had. You've been able to get to a certain level with reclaiming normal life, and then watching someone else kind of walk those steps, but maybe like a few prior to where you are today, is just really incredible. So it is very much a bi-directional support system.
Yeah. So, I think we have, our other coaches have found that as well, to reinforce what you're saying, that they have, one of our coaches has a fairly recent ostomy, and she had jumped into coaching, and, I can see her growing by leaps and bounds by, this approach to healing. And so I think I really am amazed by that. I don't think that I could have, out of the, 6 months out of the gate with my own ostomy, manage that. And so, I think that it just goes to show really how beneficial it can be. So I want to take us back a little bit to, some qualitative data, outcome stuff. I was curious to learn more about that. I know on our peer coaching forums, we ask people to tell us about how they're feeling that day, and whether they're feeling like, more successful or less successful with their ostomies. And so, how does the peer coaching impact those feelings? Does it change it? Does it move forward? Does it,
Yeah, that's a great question. At first, I wasn't sure what to expect in the data, because we actually collect follow-up data in as little as 2 weeks. And you can imagine having emotional improvements or any kind of quality of life improvements within 2 weeks is quite drastic. But we actually see the vast majority of our members, after coaching, improve quality of life metrics actually around their ostomy. They're better adjusted. They worry less about being left alone. They don't worry about having accidents as much during sexual activity. Many of them show improvements with feeling like they can lead a more productive and fulfilling life, which is really exciting too, because that's really existential to our beings as, you know, humans, is being able to have a fulfilling life. And we see people even report that because of the coaching, they feel like they avoided a hospitalization or some sort of doctor's appointment. And this is incredible. We see that in more than 60% of our members, actually. And this is an immediate benefit. This is right after their call. They feel like that the knowledge that they got helped keep them out of the doctor's office or hospital. And none of us like to be in the hospital or doctor's office, right? Especially not during these times. And so it's really incredible to see those improvements in such a short amount of time.
Yeah, I feel like I read, I might have even been in your paper, that ostomates particularly are at risk for readmission, and that the coaching can help reduce that risk. And you know, I was curious, why do you think that we are at such a big risk for readmission?
Well, I think the healthcare system is unfortunately not very well set up for post-acute education for people with ostomies. And also because it's not a super common condition, if you're in a more rural setting, you might not have the specialized nursing care available to you right afterwards. And certainly connecting with others who have ostomies just like you are harder in more rural settings. And so in addition, ostomy care is a daily thing. It's a many times a day, you know, care that you have to do. It's not like you just set it and done. And so that opens up a lot of opportunities for error. Like if you don't know how to take care of your stoma, or you're not doing the pouch changes like as you should, or you're not taking your medications as prescribed, first of all, you could kind of, you know, make your path to recovery slower. But if something really goes wrong, you could actually land back in the hospital, which is very unfortunate. And so there's a lot of aspects to daily care around an ostomy that I don't think the healthcare system currently does a great job with managing.
Yeah, you know, that education piece definitely comes up quite a lot. You know, and like you said, you know, people maybe don't realize when they're getting the surgery because they're having an acute condition, maybe they're, you know, cancer or trauma, that something happens right away, and that you do have to think about things like managing your diet, think about, you know, your clothing, think about, you know, where and when you can use the bathroom. One of the cases that came up recently for me personally was we were on a big long hike, and you know, my bag filled up, and I'm like, what do I do? And so, you know, we ended up you know, managing it fine by just doing what you do on a hike in the woods, is making sure you're away from water sources and digging a little cat hole and covering things up. So I do have to say that, like, bending over the hole as opposed to squatting over the hole just to get a little was made things a lot easier. And I tell that to ostomates too, is that, you know, sometimes just emptying the bag is a lot faster and easier than what you're used to, and that's a benefit. You know, if you don't have to sit on toilet seats sometimes and in shady places. So think of that as a net positive. So yeah, I think that that, you know, the unexpected, unexplored corners of what it's like to live daily with an ostomy is certainly something that is, you know, that the medical system is not currently equipped to build out. So, you know, if you as a doctor had, you know, all the resources, the time, the money, the budget, what would you like to see in place as people step down from, you know, after ostomy surgery and get into adapting to their lives?
Oh gosh, my greatest wish for people with ostomies is that they would have an ostomate peer coach before their surgery, right afterwards, upon their discharge home, and then at least for the first year afterwards, continuously. Because I think what I'm also learning about people with ostomies is that you can be 6 months out, a year out, years out even, from your original ostomy surgery and still not be fully adjusted and still struggle with daily life. And so I think having the care and kind of peer support in anticipation of the ostomy, and then for a good long time afterwards, at least a year, would really help people with their outcomes and also kind of being able to manage their condition successfully.
Yeah, that would be great. I wish I'd had like a big buddy to, to identify all the things that I wasn't doing successfully that could have, saved me some really sad learning experiences, learning curves. So, in terms of finding support, of course, people can come to us for coaching, but where else would you suggest they look for finding support for their ostomies?
Yeah, I think definitely still also ask your provider system and your nursing team as well, because they might know of local resources. I think local is really helpful. Of course, at Better Health, our solution is digital and it is not locally bound. But if you can find local resources, they're excellent as well. And that way, when it's safe to meet in person, you can actually meet in person as well.
Yeah, as a peer coach, I would love to have more of a room, a connection, a one-on-one in-room connection, because it can be kind of hard to find, to open up to a random voice on the telephone that calls you at 4:30. So I know that it can be a little intimidating, and it can feel like you're kind of speaking into the void. So certainly, finding that in-person opportunities, if they exist in your area. And I know that quite a few really great support groups are out there and available. One resource I want to mention to folks who joined us today is the United Ostomists of America Association. It's also short for UOAA. And they go and they're at ostomy.org. And they are a wonderful resource as well for finding support groups. If you feel like after coaching and other things that you want to search out some more of this great peer support. What would you say to somebody who thinks that maybe they don't need peer support? In the beginning, I felt like I could do it on my own. I was feeling very independent. And it wasn't until, I joined, I'd gone through the experience of having an ostomy and having to learn all this stuff myself when, I found Better Health and said, hey, you guys need to hire me because I can help advise you on these pitfalls. So what would you say to somebody like that?
Yeah, Siobhan, I think that's a great question. And first of all, I would say that's wonderful to have that level of confidence. I wish everyone had that level of confidence. But I would also say is if you are early in your ostomy journey, you might not know the unknowns yet. And so even just kind of, chatting with someone to understand what to expect, or what are the good questions to ask, what questions might come up, might be a good start. And from there, if it's easy for you to adjust, fantastic. If it turns out there's kind of bumpiness in that road, then you've already developed a relationship with a peer or a support group that you can go back to if things get harder.
Okay, yeah, I think that's great. I feel that, as a culture, sometimes Americans feel like they have to go it alone, but we don't. We can certainly reach out and ask for help. And, that's what I applaud so many of our people who come in for coaching, that they are asking for help. They're not helpless. They're not disempowered, and I think that they definitely come in feeling that way. So,
absolutely. And I think, during, given all the stress that we've gone through as a society, even for people who don't have ostomies, like we can all use an extra level of support these days. Correct. And then if you do have an ostomy, there are issues where your mental health and your physical health can really affect your ostomy care as well. And so I think everyone can benefit from a little bit extra support these days.
Absolutely. Yeah. So, I'm wondering, we have about 20 minutes left and we have a small group. I'm wondering if we want to open it up a little bit and talk to some of the folks who've joined us today and ask them about their experiences with ostomies and support and, what their insights are. Do you want to, does that sound good to you, Rosemary?
Yeah, that sounds wonderful. Let's do it.
All right.
Okay,
So
I'll give everyone a chance to talk. So please feel free to unmute yourselves and ask questions or submit some questions through the chat or Q&A function at the bottom of your screen, and we'll go from there. Hi, Jeanette. Were you trying to say something?
no, okay. So Rosemary, I wanted to ask. Oh, Raymond has his hand up. So Raymond, go ahead and talk. We can hear you.
Okay, I have found two things, and I've only done this just for a short 2 years, but I've found two things that really, really help. Find a Wukon nurse and go to your supplier and ask for help from them. Those two things have given me more information. And then we write down and take pictures every time we change, where we go back at the end of the week, depending on how many times we change, and we look and see what worked and what didn't work on those pictures. When we put the appliance on, it works for us. And then accidents, I've been very, very fortunate. Of course, I do what mommy says. I go to potty before I leave to go anywhere, make sure everything's okay. And then before we get in the car to go back somewhere, I do the same thing. So I think it's a conscious thing that we have to do. I've never really been in a situation where my appliance got full and I needed to empty.
Yeah, Raymond, I completely agree that there are, you have to be very conscious and you have to make some decisions and be deliberate about your choices. I know a lot of people want to put their, they want their ostomy system to go on their body and then they want to forget about it. They just want it to work. And folks ask so often about, what is the best ostomy system? And the best ostomy system is the one that doesn't leak on you, but it's all very highly personal. And, I can't just say there's one perfect system.
No.
You have to be deliberate.
One thing I also found out, each individual is separate. What works for me may not work for you. As far as the manufacturer products. And the same goes, even if I'm out and it gets to a situation where I do have to go and relieve myself, it can be very tough, very, very tough. I've had that happen where it was very tough to go, and it's not the most pleasant thing for people to be around, but it's an act of nature that has to take place.
That's right. I agree with you that it's a very normal biological function. We can't get around it. And so we have to face it head on.
Thank you.
Well, no, thank you. Thank you for sharing your insights. And I'm not sure if you've been able to take advantage of our peer coaching program or not yet, Raymond, but I did want to say to folks who are with us today that the way that you can sign up is to go to our website, and under our resources tab at the top of our website, you'll find the peer coaching form. So if you're interested in setting up a peer coaching session, it's very easy to do. At the moment, we're just doing one complimentary session. As we grow as a company, we're looking at adding on more, but you have 30 minutes to find and figure out, problem solve with your coaches. So I highly encourage you, if you haven't done that yet, to sign up. And just, I had somebody sign up with me the other day. She's like, I don't really have a problem, but I've had my ostomy for 58 years or 53 years. And I don't really have anybody to talk to about it. So, it was a very enjoyable conversation with her to talk about. She's been a missionary and a school teacher and all this other, down in Cuba. So it was really amazing to hear her story.
Thank you. Thank you for that information.
Absolutely. I see Jeanette or Judy, anything and Lynette, has anything come to mind for you guys? Any questions for Rosemary?
I think there are a couple in the chat.
Oh, there are? Okay. I see them. So, I was hoping you would expand a little bit more. You talked a little bit earlier about the benefit of peer support versus a support group. So what specifically can you get out of a peer coaching session or peer support session?
Yeah, our peer support sessions are specifically one-to-one. And so it's a little bit more structured than kind of a free-form peer support group that you might be able to find locally. And in that one-to-one interaction, you get the full focus of your coach. So you can ask everything and anything you've been dying to ask someone that has that shared experience with you in ostomy. And so we often get feedback that people have found the experience to be very unique and also very valuable to have that type of dedicated attention.
And one of the things I've noticed is people often have questions about products, and I like that as a coach, I'm able to say, there's a wide range of products, and I feel that often when folks are leaving the hospital, they're assigned a certain product group to use, a certain supplier. And so as a peer coach, I can say you have options. You're not relegated to one particular type of product. And, there's no pressure on me because I'm product agnostic to try and make a sale of this product or that product. I can say, honestly, this is what I've heard, or this is what other people have recommended. And so there is, like you mentioned, that credibility there between coach and coachee. All right, let me double check in the chat and see if there's any other questions. All right, I think we can, I don't see any other questions, but if you, again, at the end of our presentations, you're always welcome to submit questions by going to support@joinbetter.com or contact@joinbetter.com. We're always happy to answer questions. And then I'm gonna hand it back to Ariha, my wonderful colleague, to wrap up any bits that I've missed.
Thank you everyone for joining, and thank you so much, Sho and Rosemary. That was really, really awesome. I think we all learned a lot. Thank you all for showing up today. We really appreciate your time. Just a quick note that our regular ostomy webinar is still on for this Thursday, just like we do every week. So this Thursday, we will be talking about ostomy and your diet. Siobhan has many wonderful tips for things you can eat, maybe you shouldn't eat, maybe things are causing you problems, and you have some questions. All questions welcome. That is at 3 p.m. Pacific, which is 7 p.m. Eastern time. And so we will follow up with an email with a link to our peer coaching options, so you can sign up for a complimentary peer coaching session. We'll also include the link to sign up for that webinar. And we really hope to see you at both of those. And thank you so much again. Have a wonderful day, everybody.